Hey. Hey, everybody. Welcome. I'm just getting my voice back. Can you hear how good I sound? Anyway, hi, everyone. Welcome. My name is Marilyn Shannon, and welcome to the Breaking Free Show. Delighted to have you here. Hope you're all doing great. Not too hot if you're somewhere where it's very summery. And wherever you are in the world, we welcome you. We know that your time, your day, your moments are precious, so we're happy that you've chosen to share them with us. Anyway, I want you to know that you can partake in this show anytime you like. You can put your name underneath the window and be part of our chat. You can call in anytime if you have a landline phone, 919-518-9773, or you can Skype in with us at computers 2, that's the number 2, K Voice. Anytime you like to ask questions, to comment, whatever. And I want to say hello to our producers over here. Hello, gentlemen. We have several
Hi,
of
how are
them.
you?
Nathaniel and Amnon, how are you
Hello.
doing? Hello. Good.
Yeah,
Good,
we're
good,
both
good,
doing
good.
great.
Perfect. All right, let's get on with the show. So we have a very special guest back today because the topics that we like to talk about that are so important, we don't want to let them go. And with us today is Dr. Eric Morse.
Hello.
Hello. How are you?
Good.
Good. So Dr. Morse is back with us today. He is a sports psychiatrist, and addiction psychiatrist.
Correct.
And the last time Dr. Morse was on, we talked about addiction and spirituality and all of that kind of stuff. And today we're going to focus on the families, the loved ones who have members of their family, best friends, whoever they are, that are in an addiction, having issues. And we're also going to talk about a really important subject about burnout and stress. So stay close, get a pen and paper because we have a lot to talk about.
Yeah.
So when we talk about the families of, the loved ones who have addictions, where do we begin in that conversation?
Well, addiction is a brain disease that has a large genetic component to it. So oftentimes families are affected kind of multi-generationally. If one sibling has an addiction, it's more likely that another will develop an addiction. So I think it's really important that that you recognize that. I think family members have to practice tough love, and tough love is tough. So what tough love is you want to support your addicted family member by helping them get into treatment, but oftentimes not helping them with other things that can enable their addiction. So that might mean paying for treatment, but not paying for other items that could easily be traded or sold for substances.
Right. I want to ask you a question before we go on. You said it's a brain disease.
Yes.
I often heard that it's a soul disease. So what's the relationship between brain disease, soul disease? Is there a relationship or not?
I mean, I think there definitely is a relationship. I mean, I don't know exactly where the soul is contained, but I think part of it's probably in the brain as well. And so it's hard to kind of differentiate what's neurochemistry and what's spirit. There's no question that, neurochemistry can affect your spirit and your spirit can affect your neurochemistry. They're interlocked, right? But there's no question that there is a very predictable change in the brain with certain substances that affect the wiring of the brain so that you are much more likely to use than not use, no matter how spiritually grounded you are. I've seen plenty of folks who are very involved in 12-step, who are very active in their church or synagogue or mosque or what have you, who still cannot not use without the assistance of professional help.
Right. Interesting. Yeah, I definitely think that there's something, a strong connection and something missing
Yeah.
at some point. somewhere, whether it's the head or the soul, there's something missing. So they both are working together. So we're talking about the families. So in, not being an enabler.
Yes.
So not giving a loved one, money, right?
Yeah, that's probably the most important thing is even when um, your family member is saying that they're going to use the money for good, for good things like treatment. It's important, I think, to pay the treatment program or provider directly, not to give the money to the patient to give to the provider because that money often is used on other substances. So, I mean, I think paying for something like health insurance, so the money doesn't go to the individual; it goes to, a company. So you take. I think money can be a trigger for a lot of our folks who suffer with addiction. So if you're giving the money, you're basically saying, "Here, go use." So I think it's really important that we stay away from giving that we pay the bills directly. So if they have used and can't afford their rent, you want to pay their rent. You don't give your loved one the rent money. You give the leaser the rent money. If they can't pay their power bill, you pay Duke Power or PSNC or whatever the gas company or the electric company. You don't give the money to your loved one to pay it.
So it's not about disempowering or
Right.
empowering. It's about taking care of them,
Yeah, it's about not triggering them.
not triggering them.
Yeah, it's not you're not gonna make it easier for them to go out and use that money for things that they shouldn't be using the money for.
So that would you say that's like handing somebody a drink? Hold this for
It's
me.
almost like handing someone a drink. Yeah,
Like, hold this for me. I'll be right back.
right. I mean, it's one extra step that they have to then, text their dealer, but that doesn't take long. I mean, in this day in technology, to get the drug that you're looking to get is so easy, and a good drug dealer is going to keep in constant contact with you, even if you're not contacting them. And so, even if you change your number, or you change your email, or oftentimes they'll find you through other people, through other contacts, and make it very easy for you to relapse.
So I think it's important to recognize that sometimes, we can't cover all of our bases. You can't be, even when you're bringing up children, right? As a parent, having had teenagers and whatever, you can't be everywhere, watching their every move. But there are certain things that you can watch, and where you can watch, you watch. Where you can't watch them 24/7, you can't watch them 24/7. That's like what we're saying here now.
Yeah.
You can't protect your loved one all the time, but where you can, you do. And
Exactly.
where you can't, that's part of your self-help, is
Yes.
knowing that, right?
Yeah, I mean, ultimately, you can't stop someone from using. I mean, no matter how hard you try, it's up to the individual to want the help, to get the help, and then to use the help. And so you can't beat yourself up about it. Sometimes the disease of addiction is just so strong that no matter what you do, the power is in the hands of the individual. So I think it's important for family members to also get help themselves, either from a professional that has addiction experience or from Al Anon or Nar Anon, which have meetings, all over the world, which is not for the addicted person, but the loved ones who are suffering from another loved one's addiction. And so they'll teach you about tough love. They'll support you. They'll give you life experience so that you don't make the same mistakes that other people in the group have made. And oftentimes they'll tell you who's a good addiction professional in your area, who's not a good addiction professional in your area. So it's also a great way to get good referrals is from Nar Anon and Al Anon.
So, what are some of the things that that you would share with people here in tough love? So, the money is one another
Yeah,
thing.
money is probably the most important thing. I think deciding on, I think for particularly for parents, making the decision of when do you kick your
Yeah. Oh,
adult
that's a big one.
child out.
That's a big one.
Yeah, I mean, for you want them close so that you can help them not use,
Right.
right? But if they've got friends and family who know where they not, if they have a other addicted friends and using buddies that know where they are, that can easily pick them up, um, you have to kind of make the decision. Okay, am I enabling them by giving them a free place to sleep and eat and recover from their use, and possibly steal items from me that I don't know. They're taking silverware, they're taking, iPads and computers that you're not always using, and you know, you know, taking a little bit of money out of your wallet. Those sorts of things. You have to decide whether or not you're really helping them or hurting them. Um, and sometimes that is a very difficult decision to make. That's probably the toughest that I see is, okay, I'm not really helping you. You need to go to, a sober living situation. Um, and oftentimes our families are our triggers too, right?
Right.
We get in the same arguments. We get into, you should have done this, you should have done that. I wish I had done this, I wish I had done that. And that stresses someone out and makes them want to use. And so sometimes by changing your living situation, you're actually taking a big step into recovery, especially if you're going to a sober living situation. So that could be an Oxford house, a halfway house. Here in Raleigh, there's the Healing Place for men and women. I think they're now calling it Healing Transitions. Um,
And there are
and
places all around
and
the
there are
world.
places all around. I mean, you can just Google where you are and find a sober living situation for your loved
Let
one.
me ask you a question. What age do you consider somebody an adult? Because you have a lot of kids, let's say, who are 13, 14, 15, who are doing, I mean, when you mentioned adult, they're doing
Yes.
that adult thing where they're lying around, they're not going to school,
Yes.
they're not working, maybe they're working a little, maybe they're not working at all, they can't keep a job, they're sleeping all day, they come down, they whatever.
Right.
What age are they considered an adult?
I have, on the flip side, I've got 25-year-olds who aren't adults. They're still acting like adolescents. I think, from a treatment standpoint, 18, there's a big difference between 17 and 18. At 18, the individual basically has power to decide what they want to do, in terms of treatment, going here, going there. All pretty much all treatment is voluntary unless you go to prison and they send you to a
Right, right.
substance, a prison that focuses on addiction. Um, but when you're 17, you can send your adolescent child to um, a like a wilderness camp or a treatment facility, long-term treatment facility, and
Without their permission.
without their permission. Absolutely. Um, so, I mean, if you have a teenager at home that you want to get into treatment, it's a lot easier, and I would suggest doing it now. Don't wait till they're 18, um, because once they turn 18, they're gonna say, I've got so many using buddies, I can stay with them, and their addiction progresses and worsens instead of gets better. So I would encourage everyone who, to get their adolescent in treatment as soon as possible. The sooner you get in treatment, the sooner you get off substances, the more brain repair you're going to have, the better your outcome. So I would not wait. And can you kick out a 16-year-old? I mean, technically you can't, unless you make them an emancipated minor. You're actually still responsible for your child. So you can put them in a treatment facility, and that's what I'd recommend, getting the help that they need. But you usually you can't kick out someone under the age of 18.
Because, I mean, I hear such horror stories of kids who are like 15, 16, whatever. They stay out all night and then they don't go to school. And it's very tough on the whole family, the younger
Yes.
siblings, the older siblings who still live in the home.
Yes.
So there are facilities that parents can call
Yes.
that, that a child like that is forced to go to
Yes.
for more than a week.
Yeah, I mean, a week isn't going to really
No,
do you much.
no.
I mean, mostly, things like Teen Challenge, wilderness camps are usually the way to go. So a lot of the inpatient facilities, you may be able to stay 30, 60, maybe like the Cairn Foundation in Pennsylvania, you can stay 90 days.
And
Um,
they take insurance.
and they take insurance, absolutely. Um, and they have foundations for indigent care. So that's, oftentimes a good place to start. But usually, if you've got somebody who's really treatment resistant and you've tried that, a wilderness camp is usually the way to go, because there you can stay a year. And they have visiting hours and visiting weekends, and they can get passes to come home and those sorts of things. But to get good recovery, it is definitely worth the time and the effort and the money to get someone into long-term treatment like that.
Good stuff. Good stuff. So, if you have a question, you have a comment, you have a situation, you want to call in, please feel free. 919-518-9773. You can Skype in with us to computers, that's plural, the number 2K voice, computers 2K voice. Please feel free to do that. We have our chat going. You can take part, excuse me, take part in that as well. So, parents, I know some of this you've heard, I'm sure you've heard a lot of this before. And you're going to hear the right things over and over and over again. The hard part is taking the action. We cannot do it on our own. I've heard a lot of parents, you know, keep trying to do this on their own. And
Yeah.
I don't know how many success stories you've heard.
Well, I don't know how many success stories there are. I mean, there are interventionists that come to your home and will intervene for you, um, and experts to encourage the loved one, usually above the age of 18, to get into treatment and really prepare the entire family for the process. I think that's a good way to go. Or sitting down with a professional, wherever you are, and taking an hour of your time to come up with a plan for your family, is time and money very well spent. So I would encourage, if you're struggling with that, to get professional help.
So the conditions with not working, lying around, doing, not participating, not just all of those kinds of things are um, triggers that would say out. If you're an adult, if you're an adolescent,
Right.
it's some kind of treatment center, outward bound, any one
Right.
of those things. And go ahead.
Yeah, I think the other thing is, people lie. I mean, that's part of addiction. But urine never lies. So I think, you know, having your loved one tested, for all substances and see what they're positive for. I mean, you're talking about some of the signs and symptoms to look out for, and I would not be afraid to drug test any of my children if if their behavior seems erratic. Um, I'm whipping out a drug test and I'm watching them pee and make sure that it's their urine, and that that it's tested properly. But I would not hesitate. I mean, it's a few dollars, to spend. You get such vital information from testing it. And then I have a lot of parents that I give drug test cups to. And so whenever they see any erratic behavior, or they just decide every Sunday morning they're they're going to drug test their child to get more data, because you can't rely on the addicted individual to tell you the truth about their use. That
They
is
become
part of
really
addiction.
good at manipulating and camouflaging and avoiding those truths. So yes, if there's anything, I mean, you got to watch it. You
Yeah.
can't just make the assumption they're in there, they're peeing, and they're handing it to you. It
Yes.
doesn't work that way.
Right.
What's the percentage of teenagers, adolescents that are using today?
So, that's a difficult question to answer. So the federal government does a catchment survey. It's a phone survey that looks at pretty much every substance that we know about and the frequency of use. And so, I think most high school seniors, I think the rate is probably around 35-40%. If
That's
you
very
include
high.
marijuana, prescription painkillers, um, it's very high.
So if you've got two kids, can you almost make an assumption with that kind of percentage, or three kids, that one of your kids are using
Yeah,
something?
I mean, I think that's reasonable to
That's
assume. I mean, I think that if you've got three kids, the odds are probably more likely that zero of your three kids are using, or all three are using, because of the genetics, because they communicate with each other, they have oftentimes some same circle of friends. So it's reasonable to drug test your kids. It's so easy to do. They're not going to use their urine for anything else. They're just going to put it down the toilet
and
anyway.
it's
And
not
just run a test.
and you said, and we have a question on here that I want to ask you about. Um, but you were saying erratic behavior.
Yeah,
How do you define erratic behavior?
I would say that not showing up where you're supposed to be at the time that you're supposed to be
Okay.
there. And I think that's probably number one. So that might be missing curfew. That would be a big one. I would want to get a drug test that night. If you miss your curfew, then you're doing a drug test, and you just make that part of your routine. If you're not showing up on time for school, if you're, I think being late for things is a big one. You want to get a sense of how large your kids' pupils are, and if they seem small, then that's usually opiates. If they seem big, that's usually stimulants like cocaine. So, if spend some time looking in your kids' eyes, right? If they're a bloodshot, that's oftentimes they're smoking something, um, because of the irritation of the smoke in their
If they start
eyes.
to eat a lot.
Yeah, I would say a significant change, or if they start eating a lot less. If there's a big change in their eating patterns, their sleeping patterns, because most substances affect your ability to fall asleep or make you fall asleep or sleep longer. So those are some of the basic things.
Uh,
You probably want to look at their skin, at some point, make sure that you don't see any needle marks. Um, if they have charred fingertips, then you see that oftentimes with crack cocaine. Um, so I mean, you just be aware of what your kids usually look like and behave, and when you see something out of the usual, you test them.
so we have a really good question on here that I want to ask you about. So this is from Chris. What is it about being in nature that is healing for, well, there's so many reasons people do outward
Yeah.
bound, but what is it about being in nature that's so good for an addictive adolescent?
Um, yeah, I'm not sure the answer to that question. I think a part of it is that you're unplugged, right? So you don't have the triggers of TV, reality television, and people doing strange things and wild things. Um, Usually there's not great cell phone tower coverage,
That's right.
so you're not getting
Well, that
texts. You're not getting,
stimulation.
yeah. No, I think something to being unplugged, but then just kind of getting back to nature and fresh air, and exercise and probably better sleep habits that you see in wilderness programs. So I think it's that you're removing triggers, um, and then you're developing healthier habits. But there's definitely something to being, out in the wilderness, out in nature, and finding maybe extra spirituality in that process.
Uh-huh. And Chris is adding another question, and please feel free to join in and ask questions too. We'd love to have you, because these are great questions, and I'm a really good question maker, but I know that you have questions too. So please feel free, 919-518-9773 or Computers 2K Voice on Skype. So, do experiences like eating together as a family,
Mm.
going to a church, a synagogue, some kind of spiritual thing, extended family. Do
Yep.
these things make a difference when you have, kids who are, in high school, whatever, and they're thrown into the mix of so many kids who are smoking or taking drugs or have the propensity to do it themselves anyway because
Right.
of history or genetics? Do these other things make a difference?
Absolutely, they make a huge difference. Your environment, where how you're growing up, who you're spending time with, have a huge difference. Um, the number one risk factor to develop addiction, though, is age of first use. So if we can push back that first drink, that first use of marijuana, that first cigarette, back from age 13 to 16, even, that's going to have a huge impact because the growing brain gets more hardwired to a substance the younger that the person is. So, and oftentimes, if you're involved with family, you're doing family events, you're going to church, you're going to synagogue, you're going to mosque, whatever religious faith that you belong to, you're probably not using. Now there are some families where that may not be the case, and so um, you probably want to avoid those family members who are actively using. So bringing in an uncle that's got an alcohol problem, you don't want to do that. So I mean, there's certain exceptions to the rule, but I think that the more positive people, sober people that are in your life, the less likely you are to use. But sometimes that genetic switch is just so strong, it kind of, people can go to church for years and be very active and still be using.
Absolutely.
Yeah.
And playing sports, that's all.
So yeah, sports, actually, studies have shown that participation in athletics reduces the likelihood of use. Um, it improves academic performance, which oftentimes is surprising because you figure um, that you're taking away from studies by being athletic, but that's actually not the case. You're usually teaching responsibility and time management with athletics. It also reduces teenage pregnancy. There's actually, I'm more interested in having my daughter play sports than have my son play sports. I think it's really important that our youth, certainly their health benefits as well, and mental health benefits for exercise. But there's probably a huge exercise um, relationship between addiction and exercise that if you're engaged in kind of getting those natural endorphins in your brain, then you're less likely to need exogenous endorphins.
I may be different, but I do believe that when we're dealing with an adult, brother, sister, child, that's one thing. Dealing with our adolescents, our 13-year-old, 14-year-old, 15-year-old, 16-year-olds, I believe as parents, we can force our children to do things. You know, like I used to make my kids come to dinner.
Right.
I used to make us go out and do things together as a family. I did not buy into, well, I don't want to do that on a Friday night. I didn't listen to it. I still
Right.
had control.
You didn't give your child a choice.
I didn't give them a
Yeah.
choice. And then it got to the point where it was almost a joke because they would say to me, "Where are we going?"
That's right.
And I'd say, "We're going to this festival in Wendell."
Right.
And they'd go, "Where's Wendell?" And I'd say, "It's down the road a piece, and they'd say,
Mm,
"Can we bring so and so?" And I'd say, "Sure." Well, they started wanting to bring their friends.
yeah,
So do not buy into, they don't want to. That doesn't hold water when you're holding the car key.
that's right.
Believe me, or when you're paying for their room, they don't get to close the door
Right.
and not let you in. It's your
Right.
house. You
Yeah.
you get to knock that door down.
Absolutely.
In my opinion.
You can take the hinges off.
Yes, you can, and
Yeah.
it's been done before.
Yes.
So there are things that we have power to do
Yes.
that and I know people are afraid that their kids are going to run away or that they might do something more dangerous or things like that.
Yeah, I've heard that excuse many times that I'd rather them drink in my house than
Right.
drink in
And
somebody
that's
else's house.
yeah.
And I'm like, are you kidding me?
Yeah.
That is not a good plan. Every sip of alcohol that your child takes makes the wiring more difficult to unwire. So we should not be encouraging our children to drink at home or at their friends. And I think, starting the education, having the conversation about alcohol and drugs, in elementary school is so important. I mean, from the parents. So they did, DARE was a federal program that, it was more peer-to-peer education and program that was going through the schools. And we found that the DARE program, although it made perfect sense, didn't work. And I think it doesn't work because it's not coming from the parents. I mean, it really needs to come from the parents. Of course, you have to walk the walk if you're going to talk the talk. So that might mean that you, as a parent, might have to give up alcohol to show that your child can't be drinking alcohol. And sometimes that's part of the challenge, especially if one of the parents is dealing with their own addiction. But you as a parent, you have to make certain sacrifices, and one of those sacrifices may be to set the example and not drink if you feel like your child is having a drinking problem.
And Nathaniel has a question, but when we get back to Dr. Morse after Nathaniel asked the question, I think we should talk about husbands and wives.
Yeah.
Because we've spoken about our children. And that's another issue, because when you said, stop drinking, you think, okay, the wife has the problem or the husband has the problem. And so I want to get to that, because that's tricky.
Yes.
Nathaniel,
Yes.
what's your question?
So I just had
I'm
a
so
quick
glad he's
question
got a
for
question.
Dr. Morse.
Yeah.
So when you were talking about the drug test for younger children, personally, I feel like that would be very intrusive for that individual. So how would you go about trying to make that seem like a less intrusive act if the parent was wanting to do that for their child?
Yeah, it is extremely intrusive. There's no question about it. But just like we were saying earlier about you have to be the parent and not your child's friend, is you're going to have to be intrusive. I mean, there's no getting around it. I mean, what would be less intrusive is probably to let them pee on their own, but then you're not sure if you're getting their urine. So, I mean, you can balance that if you, want to make sure that you look in the bathroom, make sure there's no urine hanging out, and then make sure they don't have any baggies of urine on them before they step into the bathroom, and then let them pee on their own. That might be reasonable to do. But at some point you have to be intrusive, and if you make it part of your routine, especially after you've found out that one of your children is using, then it becomes more of a pattern, more of a routine, and hopefully seems less intrusive over time. I think it also depends on how you frame it, right? If you're doing this because you're out of loving concern, you're not looking to punish them, but you want to know what's going on, and they understand that is why you're doing it, because you love them and you want them to be successful in life, they're going to understand. They're going to realize that you're not doing it just because of your own appearance. You're not doing it because you don't want them to embarrass you. You're doing it because you love them and you want them to be successful in life. And if you make that clear, I think that goes a long way in, making it part of a routine.
And this is the thing. Um, when with this helping them to feel successful, when they start to feel that success,
Yeah.
that's a really good feeling.
Yes.
When they are clean and you're helping them to be clean, you can't make them be clean,
Right.
right? But you doing everything you can to help them be clean. As they're clean and they start experiencing life in a good way and they start feeling success, that's the payback. Then they know what feeling success feels like,
Yes.
and the road gets better. I mean, and you'll know as you are infringing on whatever you think you're infringing on, whether it's going in their backpacks, whether it's looking in their room. If you have a reason to suspect that something is up with your children,
Yeah.
then you have the right to go in and do those things and test
Absolutely.
them and do what you have to do until you know that they're feeling that feeling of success.
Yeah.
Julia, right now, um, what is she saying here? She says, use a branch from the whooping tree. A few marks. I don't understand.
Well, so
Yeah.
no,
What does that mean?
no, I would not beat your child. That is not a good plan. That hasn't. I don't think that's
No.
effective. I think that's only going to make them want to use more.
Right.
I know that's old school, but that I don't. I would never recommend beating your child with a stick. No, I think. I think I had some. You know, parents. Well, you can't just be their best friend. You sometimes have to do things for your child that they don't want to do. And that might be taking their car away. If you know that your child is actively using substances and they're driving your car, you are liable. You cannot let your
Right.
intoxicated child be driving.
And this is another thing you said before about giving your children a safe place to whatever.
To use.
If you do that, or if you do that with somebody else's children,
Oh, yeah.
you are very liable.
Very
and no matter what your children tell you, you can be thrown in jail
Absolutely.
and you can be sued. And if a child gets hurt, you're in big trouble.
You're in big trouble.
Big.
Yeah.
So I hope we're all clear with this. This is very important
there's
stuff.
Certain legalities involved, absolutely, for underage drinking. The age for drinking is 21. So even if someone's 20, that's still against the law. And the other thing is taking their phone away or putting a locator on their phone so you know where your child is. I mean, I know that seems, big brother or intrusive, but you have to do these things. You can use technology to your advantage. I think it's to our disadvantage in parenting most of the time, but whatever technology that you can use to help make sure that your child isn't using, use it. If that means looking in their email address and finding out what their login and password is and reading their emails to see, or their texts to see, what they're doing, I think that that's very appropriate. I mean, yes, your child's going to be upset with you for breaching their privacy, but I think that, especially if you know that they've been using, they have lost some of their rights to privacy because they've made some life decisions that make it part of the consequence, where you now need to know where they are, what they're doing, who they're communicating with, what you're talking about.
Most definitely. I think that it's everything we're talking about is very important. And if you suspect your child is doing something, if you're not suspecting, there's no reason to do it.
Right.
But if you think that there's a problem, then you've addressed it with your child, or you see these behaviors that are changing, you have a right to do this. You're protecting your child, so it's very important. I'd love to talk about the husband and wife issue,
Yes.
because I think that's another big problem that we face. Is the woman whose husband is using, or the husband is. So what are your suggestions there?
Again, tough love. It's tough. I mean, um, you're going to have to use whatever leverage you have to help them get clean and sober. And if that means the two of you going to meetings, the two of you going to, to seek professional help, um, I want to see more couples, right? Not just the individual who's affected with addiction, but also their spouse, their boyfriend, their girlfriend, their husband, their wife, coming to treatment with them for their sessions. It's valuable information. Um, so I like to see that level of engagement and that level of care by their partner. But you have to use whatever leverage you have. And if that means that you're going to leave your loved one because of their substance use, you have to do that. Or if you're going to change the locks and kick them out, then you have to do that. I mean, that's obviously you want to have conversations, you want to seek professional help before doing something like that. But sometimes that's what is required to make that change in that person is limiting, and it may be taking the credit cards away, taking control of the money. I mean, that is a big trigger, like we said earlier. So there are lots of things that you can do to help your spouse, your boyfriend, your girlfriend from using.
So, and we have a really good question about the elderly on here on the chat. But before we do that, I want to ask you. So, what's my responsibility if I'm with someone who is using?
Right.
Does that mean that I have to give up drinking my glass of wine?
I think if that triggers your partner, yes. So
would Al-Anon tell you that?
I believe so.
Okay.
I believe so. I think it depends on the substance that you're. There are people who are addicted to narcotics, and having their spouse drink a glass of wine doesn't trigger them. So in that case, you might. People who are addicted to cocaine, watching someone else drink alcohol isn't going to trigger them. So that you might not have to give up alcohol in those sorts situations, but if alcohol is their drug of choice and you are drinking in front of them, yes, you're going to have to give up alcohol. And hopefully you loved your loved one more than you love your alcohol. And if you don't, then you might have a problem with alcohol. So, yeah.
Okay. All right. So that seems like an easy kind of tweaking in your life.
Yes.
To do that, but is knowing when enough is enough.
Yeah.
That's a really tough thing. When does a wife or a husband know when enough is enough?
Yeah, it's usually when it impacts the rest of your family, right?
In your life.
In your life, so you can put up with your loved one, your spouse or your boyfriend or your girlfriend using from time to time where it doesn't impact you or your children. But when it starts impacting you or your children, then it's usually time to get help.
Right.
Yeah.
So elderly, do you see a lot of issues, kind of happening within the elderly?
Yeah, I mean, it is a growing problem, addiction in the elderly. Probably the three substances that I see the most in the elderly is alcohol. Number one, because when you're retired, you feel like, well, I don't have to get up and go to work tomorrow, so I can drink each night. Or, as you get, into your 70s or 80s, you're drinking the way you did when you were 30 or 40, and that's causing more effect on your brain because your liver isn't metabolizing the alcohol the way it used to. And so number one, I would say is the problem is alcohol. Number two, I think benzodiazepines, so your Xanaxes, your Klonopins, your Valiums. A lot of our older adults are seeing older physicians who don't understand how dangerous benzodiazepines are.
This is fascinating.
So they've been on Valium or they've been on
for their heart,
Xanax or whatever for
stuff.
all sorts of things for years, and it's never been a problem. Well, it becomes a problem, and they get confused, and they start sundowning, and You think it's some form of dementia when it's actually a side effect of a medication that no good doctor would prescribe.
You know, this is so interesting because about 14 years ago, I don't know how many years prior to this, but my mother's doctor put her on Valium for supposed to have been a short period of time,
Mm.
but they didn't take her off.
Yeah,
And we went to London, and she was a zombie.
yeah,
And we couldn't figure out why there was a buildup.
yeah.
And we couldn't figure out why she was a zombie.
Right.
And then we come back from London, and we found out that she had been on the Valium. And she didn't
Yeah.
even remember. She was just taking her pills.
Right.
She never realized that, oh, this is Valium.
Right.
And there was a buildup over time.
Yeah, I mean it's a long acting drug that builds up in your system, particularly in your
it
liver
was
stores,
fascinating.
and yeah. So yeah, there's no and there's no good medical reason for folks to be on benzodiazepines long term. There's no, I mean, I guess for certain seizure disorders it may be necessary, and some neurologic disorders it may be necessary, but as a psychiatrist, it's not considered to be
But that's
first,
the
second,
problem.
or third line.
That's the problem.
People aren't seeing
They're
psychiatrists.
not seeing psychiatrists.
There are bad psychiatrists out there who prescribe benzos
Okay.
too, unfortunately.
And they just prescribe.
Yeah,
That's another thing to be aware of also, is to be careful with your children,
yes.
your adult children, your husband, your wife, your friend, whatever it is who is prescribing these medications.
Right.
Because if it's not from a psychiatrist or they're not seeing a psychologist,
Right.
there's a problem there.
Right. It always pays to get a second opinion too.
Oh, absolutely.
You know, to get an expert opinion, even if it's a curbside. You know, where you say, "Hey, my kid's on this and this and this. What do you think?"
What do you mean by curbside?
That's just asking a friend or a
somebody,
family member who is.
somebody.
I get those all the time.
Oh yeah, yeah, absolutely. Like you go to a party,
Yeah.
you know, Dr. Morse is there, and you go over. By the way, what do you think about this? You know what?
Yeah.
Thank you for saying that.
Right, and usually in your church or your synagogue
There's
or your
always
mosque or
somebody that
somebody,
you
there's
can
a
just-
physician there
Who
that you can
yeah.
just kind of on the side when you see them ask them a simple question about, you know, does this medication, this dose sound reasonable to you if you have a
Right.
concern?
So what do you do with the elderly when this is happening?
Well, you taper them off. You know, so you taper the alcohol off because you can't stop it all at once usually. You taper the benzodiazepine off. The third, I said there were three drugs. The third one is opiates, narcotics. So, you know, pain is something that needs to be treated, but more and more we're seeing folks get on narcotics, stay on them long term, and they get addicted to them. And there are behavioral consequences for that.
Well, what does a daughter or a grandchild notice with their elderly parent or grandparent that alerts them to something is wrong there?
Well, I mean, I think it's intoxication usually, some confusion, slurred speech, memory problems. You just told them that, and they can't seem to.
And not saying it's senility. Or
No,
it's just,
but it's more short-term memory. It's more, you know, immediate recall. You know, that usually is preserved in, you know, long-term memory usually isn't affected. So you might think because of substance. So they might remember your 10th birthday party, but not remember what you just told them 5 minutes ago. And so that's usually substance. That's usually substance use. So, you know, the other thing is raid their medicine cabinet. Take a look at what they're. You know, be aware of what they're on. You know, if you're the next of kin, if you're their emergency, you know, health power of attorney or whatever.
have a list of their medicines.
Have a list of their
That's
current
very
meds
important.
because the ER is going to ask you. You know. And it may not be in the computer, so you know it's important just to know what medicines your parents are on. It's also good to know what works for them, so in case you end up with the same disease, you'll know what worked for your parents. So I often, you know, so if I have somebody who has depression or anxiety, I'll ask about family response to medications because you have the same genes. So if your mother or father responded really well to Zoloft, then I'm going to lean towards Zoloft. They didn't do well on Zoloft, and they did well on Prozac. then I'm going to lean towards Prozac. So sometimes, knowing what medicines your parents have responded to and didn't respond to will help you later on in your life. So there's good selfish reasons to know about your parents' medicines.
Yeah, I really didn't think that much about the elderly. I'm glad that question came up because
Yeah.
I think
It's a
people,
growing problem.
it is a growing problem.
And there's not much treatment out there. There aren't any geriatric treatment programs out there. They're usually put in with young adults, and it usually doesn't work very well. They compare out. It just doesn't work very well.
So what about here's another one. This is a really good topic, and time is going by really fast. Here's a really good question too about stimulant medications like ADHD. Does it lead to more problems?
So studies have actually shown. That's an excellent question. Studies actually shown in folks who have ADHD are more likely to develop addiction, right? Because they're usually impulsive to begin with, and they're more likely to take risks and use substances. But treating ADHD brings them back to the general population risk, you know, line. So treating it with a stimulant actually reduces addiction in ADHD kids.
Wow, so it's like it does and it doesn't.
Right. So if you don't have ADHD and you're taking stimulants, you are more likely to develop an addiction. If you have legitimate ADHD and you're on a stimulant, then it actually reduces the
Because
likelihood
it brings
of
you
you
back to
developing.
normal,
It brings you back to normal.
where you are not necessarily.
Right.
You don't. Right. Okay.
Like a stimulant in someone who suffers with ADHD is actually going to calm them down
Right.
and make them more focused. A stimulant in somebody who doesn't have ADHD is going to get them wired and keep them awake. So
Okay.
the response is very different. And you don't want to use a medication to make the diagnosis. I mean, that's kind of backwards. But, so you want to make sure that you know what you're treating and that the person your child has a legitimate ADHD. But that is a good reason to treat ADHD with medication, is it actually prevents addiction.
Wow.
Yes.
So that's really important.
Yeah.
That's very important because I know people who
We think the opposite.
They
Yeah.
become like zombies, right?
Right.
And they instead of learning, I guess, how to live through the zombiness
Right.
into some kind of normal, find their balance, find
Right,
their,
right.
right, they go off of it,
Right.
and then that's the problem.
Yes.
But if it brings you to normal, then you don't need more stimulation.
Exactly.
Interesting, and that's not what most people think. I don't think
I would think that most people would think I'm putting
it's an
something.
hors d'oeuvre.
Well,
Yeah.
that
Yeah.
by putting you on a stimulant, I'm making it more likely
Right.
that you're going to be dependent on the stimulant.
Exactly.
But that hasn't been shown. In fact, the reverse has been shown. That by putting your child who suffers with ADHD on a stimulant reduces the likelihood of other addictions.
So you don't need more to keep you normal.
No, I mean, you develop tolerance, and sometimes you need a higher dose of the stimulant in order to be treated and to bring you back to your normal baseline. That's normal. That's just your liver getting used to a medication, metabolizing it faster, and so that you expect that. And sometimes you have to switch stimulants because of tolerance, and you can switch back to the original stimulant or work just fine for a while until your liver gets used to it again. So it's always a fluid process. You probably shouldn't stay on the same stimulant for too long without a change, because that probably means that it's not being managed appropriately.
Interesting.
Yeah.
This is so good. Okay. We still have time for you to call in anytime you like. 919-518-9773. Or you can Skype in with us at Computers 2K Voice from anywhere in the world and ask Dr. Morse a question. If you have a situation, a personal thing, please feel free to call in, or certainly you can take part in our chat and ask questions there. So we've spoken about all kinds of scenarios. What have we left out?
I'm sure we've left plenty of things happen.
Well, is there something that pops? We've
Yeah.
spoken about adolescents. We've spoken about adult children. We've spoken about husband, wives. You know, is there anything that we should know about as far as friends? I mean, you don't have much power over a friend.
And just encouraging, asking open-ended questions and listening is probably the best advice that I can give folks when you've got a concern that one of your friends has a substance use problem. So just asking them how they're doing, being open and listening, and encourage them to get help when the topic of their use and bad decisions that they're making when they're using. Gee, do you think it's time for you to get some help with that? Just kind of asking, not saying you need to, but saying, in a loving way, just asking questions, open-ended questions, and hearing the response back, getting them to talk. Let them kind of come to the conclusion themselves that they need help, instead of you jumping to the conclusion. That would be the advice that I'd give to friends who think that there's somebody who needs help.
So self-care is extremely important when you're involved with, again, a family member, a loved one, whoever it is, a parent. It's very important that you get the support that you need to surround yourself with people who understand where you are and that you can talk to.
Absolutely.
So whether it's Al-Anon, whoever that is, it's extremely relevant, and you deserve. People, have to take the time out, and just like they say on the airplane, is put a mask on yourself if you're going to take care of anybody else.
That's right. Get your own oxygen first, so that you can deliver the oxygen to your loved one better.
Yeah. Very important. So, any other words of wisdom that you can share with anyone?
Well, I mean, the caregiver stress that you mentioned is so important. I think we all know somebody who's dealing with something that is difficult to deal with, whether it's an addiction, whether it's mental health, and asking the family and friends of that person how they dealt with it, learning from them, trying to reach out for your own help, I think is so important. And then taking a break, going on vacation. Even though you've got a loved one who's addicted, and that, let's say they're still living with you, that by taking a vacation, that might be a trigger for your loved one. It's still important to take that vacation. It's still important to live your life. And you are not responsible if they relapse. You're not responsible. You're not expected to be their sponsor. You're not expected to be in control of whether or not they use or don't use. The individual is. And so it's really important that you still live your life. And if that means kicking them out in order for you to live your life, you need to do that.
Yeah, I've personally have seen success with doing that.
Yes.
I've seen both sides. I've seen where you give up everything and you run constantly to the person and you hover and you hang out and you wait and you watch and you do this and you do that and you bring food and then you walk away and then you bring food again. I've seen more success over the long haul when you don't do that.
Yes.
And it's hard.
That's why they call it tough love.
It is
very tough.
It's tough on them,
right?
But it's very tough on
you.
You have to love yourself and that other person so much, and it is hard to love yourself when you're doing that.
Yes,
it's very hard, and it's very hard to help. And I'll tell you what else. If you are a member of a family who somebody else is doing the tough love as well, people need to come together and love each other and help each other and support each other. So if you're tough loving a brother, a sister, whoever that is, support the mother, the father, the wife, love each other and help each other, so that, because it's very difficult to not answer the phone, to not run. I know.
Yeah.
I know from personal experience. It's very hard. But when you do that, it makes a big difference.
It does.
It really does. So, Dr. Morse is at Carolina Performance, and
Yeah. So, I mean, even if you just want to ask me a simple question, you can send me an email through the website at carolinaperformance.net. My email address is morse at carolinaperformance.net. 919-676-9699 is my telephone number. So you can always call me, email me.
I think that's a really good offer. Not too many people might tell you that, but if you are struggling with something and need a little bit of that little something, I know Dr. Morse means what he says.
Yeah.
Because it's really about, people getting healing and getting better or whatever is possible. So I want to thank you once again for being
Yeah,
here.
thank you. Enjoy it.
Oh, I love it when he comes. And we have another topic I really want to talk about, so I'm going to have to ask you to come back again.
I will.
Dr. Morse is really good about talking about burnout.
Yeah.
And I think that's a really important topic that we all need to listen to. So I'm going to ask him to come back again. But with that, you're terrific. Thank you so much for being here.
Thank you.
He explains this stuff so well that we all understand it so much better once he's left his mark. So with that, I want to thank you all for being here today. I hope you have a wonderful week. If you have any questions, remember you can always reach out to me, Marilyn, at MarilynShannon.com. I'm happy to help. With that, have a wonderful day, wonderful week, and I'll see you next week. Bye.
You're tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, My Life, My Will with Gisela DiCarlo, The Tanya Love Show, Health Then with Debbie Bruck, Breaking Free with Marilyn Shannon, Triangle Be Well with Howard Jacobson, Lunch and Learn with Rabbi Yisrael Cutler, Lessons of Vietnam with NCVVI members, Current Affairs with Amnon Nissan. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section on nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by Atomos.com, makers of quality video recorders and converters, CarolinaApparel.com, and DeltaForce.net.